We still have a lot of tough situations unfolding in India, and they will continue to do that. And I am really delighted and proud that today I'm joined by someone who has studied here, and she carries a lot of accolades for her professional success, as well as being a very excellent teacher. What we have in Dr. Priya Nori is Associate Professor of Medicine and Orthopedic Surgery at the Albert Einstein College of Medicine, and she also serves as Medical Director of the Antimicrobial Stewardship Program. And there is much more we will learn from her about vaccine and where India is, and how, with the help of some not-for-profit organization, she is manifesting her compassion in action. So with a lot of claps for you, and thanks for joining us. Namaste. Welcome.
Thank you very much. It's a pleasure to be here.
So let's jump right away into you being someone who has been a part of the COVID response team at your hospital. Initially, when you started studying how it is affecting and being so much knowledgeable about infectious disease, what was different about COVID-19?
It's a fantastic question, sir, to kick things off. In many ways, it resembles other coronavirus infections in that it is a respiratory virus. It is transmitted between individuals in the same household or within a hospital ward. And it is mainly through respiratory droplets, or in some cases, small aerosols. And what is unique, however, of this virus is that it is rather lethal and rather infectious. One unique feature is the infectiousness in the pre-symptomatic or early symptomatic phase, which we know now, more than a year later, after so much that we've learned about the illness, is responsible for a large number of infections. So in this way, it's very unique.
So allow me to interrupt as a layman.
Yes.
This asymptomatic nature of COVID-19's effect is very confusing. So someone, he feels he's fine, and then he goes for a test and they say, no, you are COVID positive. And some people don't feel anything, but the test says that
Right.
you are COVID positive. How that, in some people there are
Sure.
symptoms, in some there aren't.
Right. So in the first week of COVID, that's when the virus levels are extremely high. Millions and millions of copies that are replicating and circulating within somebody's body, usually within their lung tissue and other organs. And so in that pre-symptomatic phase, the viral levels are extremely high. So just by having a conversation or laughing or singing or having dinner with somebody, you may be shedding the virus and spreading it to your contacts without necessarily the knowledge that you are even sick. It may be that 48 hours later is when you start to develop the symptoms. However, just to kind of fast forward the conversation to vaccines, because that is very much important for today, vaccines dramatically decrease all of these things. So they decrease both one's chance of becoming infected with COVID in the first place. They decrease the shedding or the infecting of secondary cases from the first case, if the first case has been vaccinated. And then the third and probably most important thing is that all of the vaccines really that are authorized in the United States and abroad decrease one's chances for severe illness, death, and hospitalization. So the benefits of any authorized COVID-19 vaccine are, just immense.
Okay, so we track back slightly, and now that we are talking about vaccine, and India also has over 23 crore people vaccinated. In America, roughly more than 50% people already got vaccinated. We feel little sense of protective shield with vaccine as a layman also. In your case, being a part of the team to respond to COVID, when there was vaccine in the making, that period must have been very exciting. And how was it when you heard about vaccine came and post discovery of vaccine, the world is different. Before it was even more uncertain. So talk to me about, as a scientist, the excitement that there is something.
Yes, absolutely. So there's so many layers to that question. So one of the most exciting things about the vaccine for people in the field is that these vaccines are a very, very innovative technology. It's not brand new technology. It's very trustworthy. It's reliable. It's been tested very, very thoroughly. But this technology has not previously been used for vaccines. So there's two important types of vaccines that we have in the States and then also abroad in other countries, including India. mRNA vaccines and viral vector vaccines. And they have been tested in other diseases and other types of disease states, but never before for a highly transmissible illness such as COVID. Ebola is one example that there was a vaccine developed that loosely looks like our viral vector vaccines. Anyway, just to kind of give the audience something that they can actually share with everyone in their families, this technology is extremely innovative. So imagine something like an electric car or 5G, Wi-Fi, or one of these things we all want our hands on, right? When it comes to tech and gadgets and how we live our lives and how we communicate with each other, we are most definitely into the highest advances in terms of technology. And the same should apply to healthcare. Personalized medicine, using every single advantage that technology has to offer, that should also apply to vaccines. And we have that. We have these very, very advanced technologies for vaccines, and they are actually the most effective vaccines that I can think of for any disease state, and this is because of the innovation that's involved.
If I may, just from layman's point of view, sometimes we wonder how a tiny little liquid, which is being referred to as a vaccine, works in my body, and I develop some sort of immune, I become immune, and very briefly, for a teenager who is just curious to learn how this thing is actually working.
Yes, sure. Incidentally, teenagers should get their COVID vaccine. It is currently authorized for anyone age 12 and up. So when I say vaccine, what I mean is the Pfizer vaccine and as well as the Moderna vaccine. And so here in the United States, all people ages 12 and up should take advantage of the ability to be vaccinated for free. So now just back to your question, the mRNA, so it's a small piece of genetic code that is inserted into a fat molecule and then injected into somebody's muscle, their deltoid muscle in their arm. And the cells within the muscle and the lymphoid cells or the immune cells take up that vaccine and they give signals to other immune cells. And then these immune cells create multiple things. They create antibodies, okay? They create signals for other immune cells, such as your memory immune cells that live in your lymph nodes and in your bone marrow. And they ensure that not only do you have antibodies against the virus, but you also have a very long-lasting protection in case you are exposed again in the future, let's say a year down the road, and then your memory cells within your lymph nodes and within your bone marrow are reactivated very quickly to respond to that threat. And so we're learning more and more about the durability of these vaccines, but it seems like it's going to last us a pretty long time, actually, because again, I can't say enough, the technology is just that good.
So now staying with the vaccine and the need for someone to get vaccinated.
Yes.
And even in America, there are some people who are reluctant and they feel that if so many people have already been vaccinated, and even if I'm not taking it, how it's going to make any difference. So what is your advice to them?
Okay. My advice is this. COVID can be deadly, regardless of your age. You can be a child, you can be a young adult or teenager, or you can be elderly. You can have no medical problems, or you can have lots of medical problems. Statistically, if you are older and a little bit infirm, if you get COVID, your chances of hospitalization and even death are certainly higher than a child or a teenager. But there have been deaths, hospitalizations, prolonged symptoms and disability, neurological impairment, all of these things in virtually every single age group. This thing kills. I can't state that enough. It has been an incredible setback culturally, economically. The only advance really has been in science and healthcare, but every single other segment of society has been severely impacted. So to save your life, to save the life of your family members who are perhaps infirm, it is our duty to each other, to ourselves, to get this vaccine for an illness that we know can be deadly. The thing that I state to my patients who are a little bit hesitant, that's not to say they cannot be convinced with enough time, but at the present time they may be hesitant because either they had the virus about a year ago and they feel that they have sufficient protection, or they might come from an underrepresented minority group which historically has a little bit of mistrust or a lot of mistrust and doesn't have the best relationship with Western medicine because of issues pertaining to structural racism. And so what individuals from those communities need is they just need some time to see that the people around them are getting vaccinated and doing very well and living their lives and traveling and having parties and all the things that vaccines enable us to do. But also they need time to develop that trust with the vaccines, with the technology, with doctors like me who are trying to convince them that this is the best thing for their health.
So let me just take the word trust and move towards the bridge that works between scientists or scientific community and policymakers or politicians. And sometimes they work in harmony. Sometimes people feel that they are not in sync to the extent that would serve people at large well. What has been your observation, without getting into too much details about it from America as well as from India's point of view?
Yes, political interference is unfortunately something that has plagued us here in the States and many other countries, especially developing countries, since the onset. Putting that aside now, because this is not a political show, I'm not a policymaker or a politician, I'm a physician. The messaging has to be very clear. Everybody has to be on the same page. The healthcare community, scientists, politicians, policymakers, everybody, public sector, private sector, has to be invested in getting as many people vaccinated in the world as possible. Not just in the United States, but truly, unless every single country has equitable access to vaccines, either through those donated by organizations like COVAX, through the WHO or the United States or other industrialized nations, or if they build up the capacity to make these vaccines on their own, regardless of the route, the goal is the same, which is that every single country should have a sufficient percentage of their population vaccinated by, let's say, the end of this year, or being generous maybe within 18-month time frame.
So, Dr. Priya, there's another question.
Yes.
I'm sorry. That is related to the number of months which this vaccine would have its effect, and what we hear is it's good only, or say valid for 6 months. Is that true?
So that was true before, but remember at that point the vaccines were only 6 months old. So we only had that period of time of follow-up data, of clinical trial phase 3 and phase 4 data, which because the vaccines were very new, we knew that they were successful at 3 months, and then that was extended to 6. And now, just in the past month or so, there have been several studies to show that this memory of the immune system probably lasts many months, if not years in some cases. Remember that the immune system is not just antibodies. It's not just B cells or T cells or this kind of thing or that kind of thing. It's all of it working together. And so take the example of a childhood vaccination, such as measles. That is 2 vaccines that you get in childhood that last you your entire life. There's no need to repeat that. And this is because it's so highly effective, recruiting multiple parts of your body as the defense, as the first line of defense. And so as we have more time to study this illness and study the impact of the vaccine, this duration of protection will be extended longer and longer, in my opinion.
So now going towards India, from the prism of a scientist with special love for India and of course for humanity at large, when we were faced with, we meaning in India, with lack of resources, many people had to lose their lives because they didn't have enough oxygen available at the hospital, and there were some other reasons also which increased the rate of fatalities. So when you started thinking with your team members here in what way to support India, to help India, what was the strategic path that you collectively thought? And also mention about another organization, AFIA, that you are a part of.
Yes, thank you. So there are many things that doctors of Indian origin have been trying to do to support their country. This comes in the form of equipment such as oxygen concentrators, know-how, expertise, and remote consultative services, raising money in the form of donations. So it's been a wonderful thing to witness how many doctors, how many nurses in this country pulled together, Indian origin or not. Really everybody's heart was there with the country, and to make sure that the catastrophes that they saw playing out were tended to. So lots of people have been doing many fantastic things. Social media has been a particularly strong vehicle, I would say, because that's where physicians like me and very well-known Indian doctors throughout this country, from places like Mayo Clinic and University of Toronto and lots of places, were able to reach millions of people, thousands of people per day, with expertise and knowledge, and saying, don't give this, give that. One of the initial problems with the pandemic in India is that there was no centralized or cohesive, really trustworthy treatment guideline. There were lots of non-evidence-based things happening. Lots of use of antibiotics, lots of use of untested, unproven medications like ivermectin, deoxyglucose, hydroxychloroquine, just so many things. You can't even name them all in 1 hour. And then finally, there was a very indiscriminate use of steroids. While we know that steroids are life-saving, in fact, they're probably one of 2 life-saving medications that we have for COVID, maybe 3, they were abused. They were abused in India. And so what happened was nobody was overseeing this process. Patients were taking matters into their own hands. Lots of patients got steroids for COVID, whether or not they needed them. And so now what we have is an epidemic within an epidemic. We have severe hyperglycemia, exacerbated diabetes, and this black fungus problem, mucormycosis.
So I just want your thoughts very briefly. As you said, and this is right, so people were not clear. When I say people, I'm talking about physicians, as to what way they would be able to help. And whatever they knew, sometimes because of lack of resources, so not having resources is one side, but not knowing what to do is what I want to address with you. And who should have been playing the key role, because among physicians community, and as you mentioned our social media, and we so well are connected throughout the globe, WHO, or is there any body which should have been sort of supplying what to do step by step?
Absolutely. So I will say that India has come a very long way in the past since March. So at a time when there was exponential growth of the pandemic and people were very desperate, and their version of the FDA was approving all kinds of drugs, thankfully that has come under control. And just as of May 27th, the Ministry of Health in India released a very state-of-the-art guideline that is scientifically sound, and it is very much in parallel with what our treatment protocols here are in the United States and in the UK, and it finally looks like something that resembles science. And so there's no excess of anything, and they give very clear guidelines of who should get what drug and when. And so that is there now. Let's, focusing on the path forward and focusing on the future, now everybody's on the same page about that, and that has been a nicely coordinated endeavor by the Ministry of Health.
And what is this black fungus or white fungus as we hear?
So black fungus is basically, it's a environmental mold. Basically, it's ubiquitous, or it's found everywhere within the soil, within moist environments. So a place like India, that fungus is already there in abundance, but it tends to attack the vulnerable patients and vulnerable situations. And so patients who tend to get black fungus infections have very high glucose levels, whether that's related to their underlying diabetes or the profound steroid use. It's probably both. But then also in some of the phenomenon we observed was that in home treatment of patients with poor oxygen levels, or use of these oxygen machines and the tubing, and all of these things can become contaminated. And if you're using medical grade equipment outside the hospital, well, you have to make sure these things are disinfected properly, and that the same prevention protocols are used at home as are supposed to be used in the hospital.
So, Dr. somehow time always runs, and there's so much to learn from you. But I also want you to talk to us about the variants, and that is causing extra anxiety as how, and will the vaccine that we have in place also addresses the threat by this variant?
Yeah, sure. I'll be happy to address that. But just to kind of close the loop on the black fungus situation, this is a totally preventable problem. If we did not have mucor infections in the United States in the degree that they have in India or anywhere else on Earth, not even in tropical climates, not in Brazil, not anywhere, there was something going on in India, and that was the indiscriminate steroid use. But again, focusing on the path forward, finally that seems to be coming under control. So the variants. Why did the variants happen in India? And this is very, very clearly because of the rapid spread of infection. Variants are mutations. They're viruses that contain multiple mutations, but some of these mutations contained within actually make the virus more infectious, more easily spread between one person and another, and potentially make it so that medications and potentially vaccines may not work as well. But the good news is that there are studies now showing that in the vaccine sera tested against the variants does still retain a good level of activity. It's not 100%, okay? It's not even 90%, but it is probably optimistically close to something like 70%, and the most important outcomes are retained, which are that it prevents a death and it prevents severe infection and hospitalization. So that's a major win. So we can feel confident in the vaccines that we have, whether it's mRNA vaccine, whether it's Covishield or Covaxin or Sputnik or any of the vaccines that are becoming available in India. If we can get enough of the population vaccinated, the variant issue will become less of an important issue. One thing that's very important to mention is that let's take a look at what's happening in the United Kingdom. United Kingdom is basically I think the second country in terms of vaccine success in the world, in terms of percentage of their population. Because they procured, they locally sourced, they made their own, they studied their own vaccines, and they were way out ahead of the game. And they've been vaccinating individuals since probably November or December of 2020. So they had a huge head start. However, one very important thing for the audience is that if you look at what's happening now, our Indian variant, or technically the Delta variant, is taking a foothold there. And because there's a large South Asian community there, the UK is starting to see a slow increase in COVID cases again. And this is because of this B1-1.617.
So sorry to interrupt, Dr. Priya.
Just to tie it back to vaccines, these individuals are not fully vaccinated. And so it's not a vaccine failure, it's just that we have to continue to vaccinate as many people as possible to truly eradicate COVID.
I'll take this cue and I will request each and every one of you are not vaccinated, you should get vaccinated. And it's such a pleasure listening to Dr. Priya Nori, because she is good at sharing ideas in a way which brings her the title of Rising Star from the Department of Medicine. She has been a Teacher of the Year and wonderful communicator, as well as thorough professional and knowledgeable about the theme that we had today. Hope to have you again, yes. Dr. Priya. Looking at the time constraint, I have to leave it at that for now. So thanking her and thanking all of you for being a part of this conversation. This is Ashok Vyas. Namaste.